Hi everybody. Now I am dealing about cell injury. Okay. From first year itself, we studied about cell injury. Sorry, second year itself, we studied about cell injury. Cell injury means what? Functional and morphologic effects of a variety of stress on the cells from various etiological agents which result in changes in its internal and external environment. Any internal or external environment changes will happen. Or that is what? Cell injury. Okay. Then, what are the response to? What are the response to this cell injury? First one is cellular adaptation. First one is cellular adaptation. What do you mean by cellular adaptation? Cell may adapt to injury or changes that are expressed morphologically and revert back to normal in which the stress is removed. When the stress is removed, the cellular cells damage will reoccur. The cell damage will be reversible. That is the revert back to normal after the stress removed. Then next one is cell injury. Cell injury in this first one is when the stress is mild to moderate, then the injured cell may recover known to reversible cell injury. Next one, cell injury, maybe two types are there. Reversible cell injury and irreversible cell injury. When the stress is mild to moderate, then the injured cell may recover known as reversible cell injury. Then next one is when the injury is persist and is severe, the cell may die called irreversible cell injury. So cell injury is mainly two types are there. Then next one is intracellular accumulation. The residual effect of reversible injury may persist in the cell as evidence of cell injury at the subcellular level, or metabolites may accumulate within the cells. That will happen the intracellular accumulations. Then, what are the etiologic cell injury? What are the etiologic cell injury? First one is acquired causes. Acquired causes. The next one is genetic causes. First one is acquired causes. The next one is genetic causes. First one is acquired causes. What are acquired causes? In acquired causes, first one is hypoxia and ischemia. In hypoxia and hypoxia, there is hypoxia means what? Oxygen reduction. So cells require oxygen to generate energy and perform metabolic functions. Deficiency of oxygen leads to failure of above functions. So it mostly causes cellular injury. അതായത് സെൽസിന് ആവശ്യമായിട്ടുള്ള എന്തുവാ ആ ഓക്സിജൻ കിട്ടിയില്ലെങ്കിൽ ഇറ്റ്സ് മേ ലീഡ്സ് ടു സെൽ ഇഞ്ചുറി. എക്സാമ്പിൾ അനീമിയ, കാർബൺ മോണോക്സൈഡ് പോയിസണിങ്, heart disease, lung disease, increased demand of tissue, cardiorespiratory insufficiency. These are the example for hypoxia and ischemia. The next one is physical agents. Physical agents means what are they? Mechanical trauma. Mechanical trauma means road traffic accidents. Then thermal trauma. Thermal trauma means by heat or cold. The next one is electric shock. The next one is radiation. Radiation, example, ultraviolet rays, X-rays, etc. Then next one is rapid changes in atmospheric pressure. Rapid changes in atmospheric pressure are these are the physical agents. The next one is chemical, and next one is chemical and drugs. What are the chemicals and drugs means? First one is chemical poison such as cyanide, arsenic, mercury. Then strong acids and alkalies. Then environmental pollutants. Then next one is insecticides and pesticides. Then oxygen at a high concentration. Then hypertonic glucose and salts, then social agents such as alcohol, then narcotic agents, drugs, then therapeutic administration of drugs. These are the chemicals and drugs. Then fourth one is infections. Infections means various infections are there, such as bacteria, virus, fungi, protozoa, and other some parasitic causes cell injury. These are the infections. Then next one is immunological agents. In immunological agents, immunity is a double-edged sword. That is this immunity is a double-edged sword. It protects the host and also causes cell injury. It protects the host and also causes cell injury. Example, autoimmune disease, hypersensitivity reaction. The next one is anaphylactic reaction. That is autoimmune disease, hypersensitivity reaction, anaphylactic reaction. The next one is nutritional derangement. In nutritional derangement, first one is nutritional deficiency disease. In nutritional deficiency disease, first example is marasmus, kwashiorkor, anemia, starvation. These are the example for nutritional deficiency disease. Then next one is nutritional excess disease. Nutritional excess disease means obesity, hypertension, heart disease, atherosclerosis. These are the nutritional derangements. Then next one is aging. Aging means cellular aging is also causes sense. This leads to impaired ability of cells to undergo replication and cell death. This is the aging. Then next one is idiopathic cause. Idiopathic cause means hypertension, cancer. These are the two causes for idiopathic cause. These are the occurred cause. These are the occurred causes. Then next one is genetic cause. In genetic cause, there is autosomal dominant or and recessive disorders, and the second one is sex-linked dominant and recessive inheritance. Then, what are the pathogenesis of cell injury? What are the pathogenesis of cell injury? In this, some factors pertain to etiologic agent and host. In this, first one is type, duration, and severity. In this, small dose of chemical toxin or short duration of ischemia causes reversible cell injury. Also, larger dose of same chemical or persistent ischemia can cause irreversible cell injury. This may small dose of chemical toxin or short duration may lead to ischemia causes reversible cell injury. But same is this large dose of same chemical or persistent ischemia can cause irreversible cell injury. In type 2 status and adaptation. In this skeletal muscle can withstand hypoxia injury for long time, while cardiac muscle suffers irreversible cell injury after 30 to 40 minutes of persistent ischemia. What will happen? Skeletal muscle can withstand hypoxia injury for long time. Injury long time will persist, but cardiac muscle suffers irreversible cell injury after 3 to 4 minutes leads to ischemic condition. Then next one, underlying intercellular phenomenon. In this, there is two changes will happen. First one is mitochondrial damage. That means inability to reverse mitochondrial function. Next one is disturbance in membrane function. That is, these are the two things happening in underlying intercellular phenomenon. So with this presentation is over. Thank you.